Shall we start the session, sir?
Yes.
Good evening, everybody. Good evening to another session of the webinar series conducted by Ashtanga, K.S.Varier's Ashtanga Ayurvedics Private Limited. We are very happy to have all of you here. We are expecting a few more to join us because it is a Sunday with a little bit delay, I guess. But then I see that quite a lot of people had registered and were very interested in the talk and hoping to see all of them today. So with that, I'd like to ask our Executive Director, Mr. T.R. Shri, to give a few words on K.S.Varier's Ashtanga Ayurvedics Private Limited. Over to you, sir.
Thank you, Dr. Girish. It's always a proud privilege to introduce K.S.Varier's Ashtanga Ayurvedics Private Limited to all of you. Thank you all for joining us today evening. Special thanks to Dr. Zankhana for being here to introduce a topic that is very relevant for the day. K.S.Varier's Ashtanga Ayurvedics Private Limited was started by Ayurvedian K.S.Varier, who did his studies in Kottakkal during the period of 1933. He completed his course in 1933 and started this institution in 1936. He started manufacturing his own medicines. He also had preparations from Kottakkal for some time, after which the World War II, it was very difficult for goods to be transferred from Kottakkal to this place. And so with the permission and the grant of his mentor, K.S.Varier of Kottakkal, he started manufacturing his own medicines. And from 1936 on, today it is 85 years and we have been manufacturing over 300 medicines. K.S.Varier was a very, very practical person. He started his life very humbly. From very humble backgrounds, he started his life, and he has brought this institution to such a level that we are all proud of working here and working with. He has given us a proud, very, very proud lineage that we are carrying forward. He has had experiences through treatment of even animals. He has treated animals. For example, he has treated the elephant of the temple elephant of Rockford Temple, Trichy, which had cancer, and he treated that elephant for about 2 years. The doctors had declared that the elephant will die in 2 months, whereas Varier took the challenge and he treated the elephant. The elephant was alive for 2 years and more, and it died of a different cause, not of cancer. So this was something which delighted us, and it was an information that he passed on to all of us, that all our medicines are so helpful in treating anything and everything. So with that short introduction, let me go on to give back the stage to Dr. Girish for further introduction.
Thank you, sir. Thank you for that wonderful introduction on K.S.Varier's Ashtanga Ayurvedics Private Limited. Before I talk about the topic and the speaker, I would like to introduce our Medical Superintendent and Senior Most Dr. K.S.Varier here. Good evening, sir. Our MD is yet to join. He would also be joining us soon.
Good evening. Okay.
So with that, I'd like to go on to the topic. Today's topic, when we talk about today's topic, it is very common for everybody to see that medicines have become the biggest line of lifestyle for everybody these days. So medicines play a major role in improving one's life expectancy and quality of life. Of course, great. However, most of them need not be used lifelong, unless in a few conditions. So it is important to know which medications are really needed and which medications could be stopped. So prioritizing and stopping Ayurveda prescription medicines when and how is the topic which we are going to talk today. And the topic is given by Dr. Zankhana Buch. Dr. Zankhana, the Medical Superintendent at AyurVAID Hospitals Domlur, possesses 15 years of experience in the field of clinical Ayurveda. She holds a bachelor's degree in Ayurveda medicine and surgery from Shri, Gulab, Kunverba, Ayurved Mahavidhyalaya, Gujarat Ayurveda University, Jamnagar. She's a postgraduate from IPGT and RA Jamnagar and specializes in Kayachikitsa. Dr. Zankhana is also specialized in improving and enhancing the quality of life of cancer patients with Ayurveda medicines and treatment. She has led AyurVAID's Integrated Cancer Rehabilitation Program, ICRP, since 2012. Further, from the point of view of preventing relapse and spread of cancer, she manages tertiary prevention programs. For those with familial or other primary risks of developing cancer, she has developed primary prevention programs based on a personalized Ayurveda prescription of diet, lifestyle, herbal medicine, deep system detox therapies. Dr. Zankhana's pioneering work in diabetes reversal and diabetes management through Ayurveda has found mention in international medical journals. Her focused area of classical Ayurveda treatment includes diabetes, Parkinson's, PCOD and menstrual disorders, lifestyle and metabolic disorders, cancer care, cardiovascular problems, and respiratory disorders, to mention a few. She has received Jivaka Award in 2003 by Himalaya Healthcare Himalaya Healthcare Company for academic excellence in B.A.M.S. She is a member of the Society of Integrative Oncology, SIO, the premier multidisciplinary professional organization for integrative oncology. Dr. Zankhana's researches as principal investigator, including Ayush EMR COVID-19 prophylaxis, pre-exposure Ayurveda prophylaxis for COVID-19 in healthcare workers, a pragmatic risk stratified randomized clinical trial, PRASACT. She has participated in many national and international seminars and conferences related to Ayurveda. I am also very happy to say that I have been part of the team of Ayurved and have personally also been very happy to have worked with Dr. Zankhana for the past few months now, and will be continuing the work on various disorders we find in lifestyle, as well as how to stop medicines, because that is the thing she is championing for, and that is what we all would like to learn from her. Thank you, Dr. Zankhana, for being the pioneer for that. And with that, I would like to ask Dr. Zankhana to take up the stage. But before that, I'd like to ask all participants to kindly mute yourself. Any queries that you have, you can put it in the chat box. In between, as well as at the end of the session, we can take up the questions. The end of the session question answer session can be a continuous process, whereas in between it can be an interactive process, as mentioned by Dr. Zankhana. Are you comfortable with that, Dr. Zankhana?
Yes, Dr. Girish.
Thank you, ma'am. Thank you. And we are very happy to have you here. Kindly take on the stage, ma'am.
Thank you, Dr. Girish. My pranams and namaste to respected Dr. K.S.Varier, Mr. Shri, Shri K.S.Varier's Ashtanga Ayurvedic entire team, my colleagues, respected Rajiv sir, and all my dear friends. It is indeed a topic that I was thinking that what should I choose? Because as an Ayurvedan, we have always been into pioneering areas of Ayurveda, where we believe in precision Ayurveda and evidence-based Ayurveda. While everybody talks about evidence-based Ayurveda and also going towards practicing classical Ayurveda, it looks into the entire approach of Ayurveda, diet, lifestyle, medicine, and therapies. Everywhere across, it is almost 99% about prescribing, giving a prescription all the time. Do this, do that, avoid this, avoid that. But I thought, with my experience and of especially the last 3 years that I have been meeting patients at Ayurved, I had to spend a lot of time in educating and making patients aware about stopping certain things, especially Ayurveda medications. And there were 2 very specific scenarios that I have been increasingly coming across with the patients. And this post-pandemic, during pandemic. And the other thing, which is completely not related to pandemic, but that has been going on silently over a period of time, is about multimorbidities, comorbidities in various elderly age group of patients. So I took these 2 major scenarios where Ayurveda prescription really did lot more harm than good. So at that point of time, I thought, as an Ayurveda physician, I should really do something different and think about it while sharing about this. So I started reading extensively that what does the conventional medicine talk about it? How does it deal with the problem? So I found across the literature that this subject is not very old. It is very recent that even conventional medicine has started talking about this concern and concept. It was only about in 2003 that the physicians and the researchers in modern medicine started talking about polypharmacy and de-prescribing. So with this, I would take permission to share my screen and begin today's presentation.
Yes, ma'am. I hope you can share. Yes.
Yes. So while we will certainly cover some of the areas of de-prescribing as a whole, because this is first time that a concept that has been chosen to talk about prioritizing and stopping Ayurveda medicines. So for that, I did a literature search of Ayurveda Samhitas as well as the conventional literature on this. Since there is very limited reference and a literature review available on this, many of the points that I have presented here today are just an initial framework, and we all together, all stakeholders present here, patients, physicians, my learned colleagues, policymakers, we all need to build upon this and take this forward, a narrative that will really change the name and image of Ayurveda. So the first scenario that increasingly that I have been coming across since March 2020 are patients who have been on classical Ayurveda medications. The narrative and the guidelines recommendations by Ministry of Ayush, by Ayurveda physicians has been to improve immunity, to prevent COVID. With this three popular things that we are seeing patients who are on is Ayush Kadha, Chavanprash, and turmeric milk. This has been prescribed with a proper protocol that who should take Ayush Kadha, how many grams of Ayush Kadha should be boiled and taken, and who should not take. Similarly, for Chavanprash, there are broad contraindications that diabetics should not take, people with indigestion should not take. Similarly, for turmeric milk, broad contraindications are laid down. Yet, we are increasingly finding people who come with this prescription, and where we have seen people coming with an endoscopy report which spoke about erosive gastritis, fissure, and piles. And this has been increasingly seen in last 3 years. You can see here that there is a report which was published in one of the newspapers where the doctors, all surgical oncologists, surgeons and physicians who have come across this have found that there is an excessive use in terms of dose as well as prolonged use. Indefinite time through which people have been taking. There is no upper limit that has been described that for how long should a person take these items. So people are not very clear and guided as to when to stop this. The second situation that I would like to share, this is from my consultation yesterday. Name has been changed for privacy reasons. Srimati Rajalakshmi, 76 years old, elderly female. She has been coming to my practice for last more than 5 years for classical Ayurveda Panchkarma treatments. She has been suffering from type 2 diabetes with diabetic neuropathy, and over her bilateral lower limbs, she has COPD. She's a stable cardiac patient with some amount of coronary artery disease and hypertension. She has been following the conventional guidelines given by a cardiologist, pulmonologist, and neurologist. And apart from my usual classical Ayurveda prescription drugs, which are just two, Dhanvantram Ghritam and Dhanvantram Gulika, her sister, who is also a renowned Ayurveda physician, has advised her to take a combination of Guduchi, Gokshur, and Amlaki, that is popularly known as Rasayana Churna, which is a classical Ayurveda product from Ashtanga. She is on this for last 2 years. She has been also following a well-known Ayurveda guru in Bangalore, and as per his recommendations, daily consumes Kumari aloe vera swaras early morning and a neem tulsi kadha every afternoon. Recently, her son-in-law, who is an topmost endocrinologist from Yale University, was on a visit to Bangalore, and he suggested, considering her polyneuropathy, diabetic neuropathy, that vitamin B12 supplement is essential and she should have it. Apart from this, from her own experience, that she is 76 years old, from her practice at home, she has been taking isabgol powder regularly. She feels that this helps for good bowel. So yesterday when she came, I asked her to come with the entire bag of prescription, because her medicines include conventional antihypertensives, statins. She is on blood thinners, low dose aspirin. She is on, because of her postmenopausal state and various kind of reproductive genitourinary atrophy, she is on conjugated estrogen tablets and many other things. As you can see here, she is on antacids, she is on pregabalin, as well as she uses an inhaler. With all this, she also needs a zolpidem to get a good sleep. Now, with all this, when I see a patient, I have in front of me two situations. One, I need to see a patient with multi-morbidities. And at the same time, I have a patient whose multi-morbidities, comorbidities, and the entire samprapti from an Ayurveda perspective is not natural. It is driven by various kinds of medicines that she is taking. And here, as you can see, I have highlighted in some of the colors that she is on allopathy, she is on supplements, she is on Ayurveda medications. So here, where do we begin? We come across the entire situation of polypathy. So this practice of simultaneous use of medicines and adopting multiple guidelines, right from Ayurveda to homeopathy to naturopathy to all kinds of systems that from various pathis, in absence of a better word, I have referred it and put it as polypathy. Here I mean that at same time, patient is following guidelines, nutritional guidelines from Ayurveda as well as from the other pathis. So apart from intake of medicines, there are also a lot of indications, contraindications from different aspects and systems of medicine that a patient is going through. With this situation, I also find increasingly that patients like Srimati Rajalakshmi, they go through the burden of polypharmacy. Let us understand what is the standard definition of polypharmacy. So the literature shows that in anything, right, more than 2 to 10 number of internal medications that are used and with duplicative indications where mode of actions are overlapping, there is a chance of drug-to-drug interaction, there is chance of disease-drug interaction, inadequate attention to pharmacokinetics, pharmacodynamics, or there are certain items in the prescription that you could see that simply the patient is taking for no indications. That could be over the counter, that could be by experience, or that could come in as a part of a nutritional guideline from a different system of medicine. So it's regular use of at least 5 medications. And we see this very common in elderly patients. But of late, and COVID especially, we saw that even the younger group, the number of medications were 10, 15, 19. And we found from our experience of handling COVID patients as long as highest as 20 to 30 medications that were given. And what leads to polypharmacy? Apart from having multi-morbidities and comorbidities, it is also because patient is managed by different physicians, different experts. There is fragmented care that happens. people with various mental health issues, and people residing in long-term care facility. So these are some of the standard observations from the literature search that has shown that what leads to polypharmacy. It is also comes from the documentation purpose, like fact that poorly updated medical records, where patient who has stopped previous medications, but when seen by a physician elsewhere or a junior physician is advised to say continue all. So when that CT all, in that scenario, mostly the patients are becoming increasingly a burden of polypharmacy. So this is one of the paper which talks about how to manage polypharmacy. So polypharmacy management by 2030 is going to really be a challenge from patient safety angle, because as we can see here, percentage of people taking 10 or more medications by age group would be increasing. 30% in first age group of 40 to 64 years, 65 to 84 years are about 65%, and 82% greater than 85 years. And it has been found that irrespective of age, frailty and number of medications correlate, because this also all the Ayurveda physicians and colleagues would be able to make this correlation that more the number of medications, kashayas, or from any system of medicine, more there is an overload to GI system, to liver, to intestines, and to kidney. Therefore, the frailty, the absorption, reabsorption process of physiology that happens in GI, and the outcome of that with respect to bones, muscles, the primary essence, adaptive immunity, innate immunity, gets compromised. And this leads to slow progression towards frailty. Consequences of polypharmacy, we can see very clearly that in such group of patients, there are higher chances of adverse drug events. While patient may say that I have been taking a lot of medications, we may see that people on polypharmacy are likely to miss their essential drugs in that burden of taking too many things during the day. There is unnecessary expenditure. Financial burden is certainly the thing that everybody needs to consider. Of all, I find risk of drug to drug interaction, especially when this comes to our system of medicine. This is very less documented, very less reported. We have been talking about safety profile in animal studies or in some low dose single drug items like Sudarshan, Ghanvati, etc., which have proven to be safe in certain group of patients. But what happens when the patient is on polyherbal formulation or multiple drugs that the patient is taking? There is increased risk of hospitalization, and as patient would be progressively frail, risk of falls and fractures in elderly patient would increase. So what is the answer to this? As a physician and as a person who is concerned day to day when we are seeing such patients, the answer lies with judicious prescribing. It is time for all of us, when we come across the patients with multi-morbidities and polypharmacy, to look into medication reconciliation, to assess for safety and efficacy, what could be the reason why the drug is not working. That whole prescription cascade, one medicine leading to side effect, the other thing going inside to reduce the side effect. So entire process of monitoring and pharmacovigilance, assessing patient's own experience and understanding how the patient finds it, what are the issues, what are the reasons for non-compliance, looking into drug and drug disease interactions, and for the best of the outcomes, how do we work with the patient to alter the dose, to alter the system? So what we usually do as Ayurveda physicians when we come across patients with multimorbidities and people on essential drugs is that we try to reduce, for example, you can stop taking or you can taper antihypertensive medication. I will add Cardocam. I will add Brahmivati. That is the tendency. Rather than looking into our prescription, we try to taper that for which we are not an expert. I feel this is one of the most and a biggest concern that Ayurveda physicians and stakeholders should keep in mind, because increasingly everybody is talking about integrative system of medicine, one system of medicine. So instead of taking point of de-prescribing or reducing drugs from different system of medicine, one should look into only where one is an expert at. So for this, Ayurveda's judicious prescribing is important. So I thought of taking all of you through what does the literature say about quality of Ayurveda prescription and where are we at this point. So this is a paper by Dr. Sanjeev Rastogi, which looks about development and pilot testing of prescription quality index for Ayurveda prescriptions. So there were about 1576 indoor prescriptions that were generated in 2015 from a state Ayurvedic hospital in Lucknow. And from this, there were about very few of them qualified for the study. The study revealed large information gaps in components of prescription, and mostly the significant gaps that were found were in the fundamentals of clinical examination, disease diagnosis, and Ayurvedic drug intake methods. You can see here that of total prescriptions, around only 224 prescriptions, 16% of the total had mentioned about total duration for therapy. I stress upon this factor of duration of therapy because while rest of the things can still be managed, dose, frequency, anupana, time of use in relation of food, etc. But duration plays a very important role when we are talking about prioritizing, stopping, and de-prescribing. So how does an ideal Ayurveda prescription look like and what should it be? So it is based on Chikitsa Siddhant for that particular Vikriti. So we have reached at a point after completing all the parikshas, after completing complete assessment, we have drawn a Chikitsa Siddhant for that particular Vikriti, where we have looked into dosh, dushyas, we have looked into ama, agni, all srotases, srotoparikshas have been done, srotodushti has been established. We have considered Nidanarthkar Rogas, everything. And after that, a Chikitsa Siddhant for that particular Vyadhi has been derived. Now, Chikitsa Paddhati, an ideal Ayurveda prescription, is a comprehensive approach of diet, lifestyle, Ayurveda medications. By that, I mean both internal, herbal, herbo-mineral preparations and details of Panchakarma therapies, which includes count, preferable time of the day, duration of the treatment, details of the medicine to be used with therapies. I would like to all of you to focus on this because the entire concept of de-prescription or de-prescribing is not just meant or limited to aushadas, that you cut off one churna, one kashayam. In this entire prescription, the concept of prioritizing and stopping or de-prescribing should equally focus on when to say no to certain diet, certain lifestyle, and certain amount of Panchakarma treatments, because people are used to taking Ayurveda Panchakarma treatments off and on whenever they like it. It could be Abhyangam, it could be Shirodhara. People, because of Google, because of a lot of information, people are getting aware and are informed about Ayurveda therapies. in one way it is good, but it is also doing harm because people do not know where to go, when to do the therapies and how to do it. So I would also look into de-prescription from not just the medicine perspective, but would also try to bring in de-prescription or de-prescribing even the therapies for this concept. And so the details of Aushadha, for example, typically would look into dose, it would look into vehicle Anupana. There are special instructions given and duration. When it comes to duration, duration is unlimited. A physician may feel that he or she should take for 7 days, 21 days. Some physicians prescribe for 41 days, 48 days, and 90 days. So why? Why so much of a discrepancy, difference in prescriptions? So this is left on the Ayurveda physician to describe. When I did a Samhita search, I called up few of my colleagues and I did really a search to find out that what is it that is missing. So one of the textbooks says about one mandala, which is about 48 days, whereas some of the Rasaushadhis do talk about the duration and upper limit, but Falashrutis of most of the popular medications do not tell up to what limit should a person take. It talks about the ingredients, it talks about the mechanism, which dosha or which agni, it talks about indication for which disease it works. And it talks about in a language which, like for example, Chavanprash or Brahmarasayanam, but nowhere it is mentioned for how many days the drug should be taken. So why? Classical Ayurveda formulations, do they not have duration or upper limit? Certainly not. Ayurveda does have that concept, and which is laid down by Acharya Charak, which is about rational therapeutics. It talks about matra kalashraya yuktihi siddhi yukto pratisthita tishtati upari yuktagno dravya gyan vanta sada, which translates as that therapeutic aptness or rational therapy certainly depends on matra and kal. Matra is dose, kala is time, and success or efficacy of any treatment depends on yukti. But prior to the application of yukti, the physician should always possess complete knowledge about the drugs, which means that a physician should certainly use various factors that go in deciding the dose and kala, for how long it should be taken. The outcome measures the clinical response that is expected and the units of samprapti that we want to be addressed with that certain period of drug administration. But yet, very clearly, it talks about in Vimanasthana that Pipli, Kshar, and Lavan, these are 3 items that should not be taken for longer time. And here comes the concept of tapering. While it was known that only steroids or antibiotics or hormones are to be taken in a tapering or a sliding scale, but Ayurveda did talk about Kramen Upgamanam. We have not been utilizing this concept of Kramen Upgamanam or tapering dose uniformly in all our prescriptions. And it also talks about and it highlights that what happens that if you do not do this, patient becomes habituated to this. There is a thing that physiological adaptation or satmyam, which happens, which makes the patient resistant to the drugs that go inside. So how do we then take care? It is left on the physicians to decide. There is no clear or no a clear tool that is established or available in Ayurveda. It just leaves on the yukti of the physician that matra and kal has to be decided based on the doshas, based on various factors. But when you leave it so open, there are so many chances of errors. How do we minimize that errors? I think it is important that we take care of both management of polypathy and polypharmacy. This can be done through appropriate and adequate prescription. And within this comes the concept of de-prescribing. De-prescribing is really an essential component of good prescribing. We need to bring back some of the good practices that have been mentioned in samhitas but are not really highlighted or implemented in a way that we could use it in our day-to-day practice. So there are certain steps. This is from I have adapted this from one of the reference, where first step of de-prescribing should be what matters to the patient. Identify essential and just right personalized health management approach, which is ideal for the patient. Look into and check whether the patient takes any unnecessary drug therapies. Are really all therapeutic objectives being achieved by doing this? Is the patient at the risk or side effects or suffering from any actual effects of the whole management that is going on? Is it financially viable? What could be the alternatives? Is the patient willing and able to take drug therapy as indicated? There could be many more steps to this, but this is just a guideline that when you look into an adequate prescription, apart from just looking into getting outcomes or getting quick result and making patient happy, we should also look into safety, efficacy, and how do we help the patient to sustain when especially people with polypharmacy and polypathy. So de-prescribing, as I told you, the first concept of de-prescribing was published in an Australian pharmacy journal, where the article was titled as De-prescribing to achieve better health outcomes for elder patients through reducing medications. So from 2003 to almost up to 2017-18, this whole concept of de-prescribing polypharmacy was only limited to geriatrics and elderly health. Only very recently, 2018 onwards, we can see a narrative which goes for de-prescribing for all. So this article outlined that one should review all current medications, identify the medications to be ceased, substituted, or reduced, planning a de-prescribing regimen in partnership with the patient, and frequently reviewing and supporting the patient. This fourth step is very important, often not done, because we may ask the patient to discontinue, but then what happens to the vital parameters? Do we review? Do we support the patient? It is actually the process of withdrawal of an inappropriate medication supervised by a healthcare professional with the goals of managing polypharmacy and improving outcomes. This is the de-prescribing rainbow published in 2018 in British Medical Journal, which talks about this, the goal to be that something which is ethical, which is respectful. I have added the word safe to highlight, because most of the things just look into that how successful it is. But this concept should also as much focus on safety of the patient. And with this literature search and review that I did, I have also tried writing here some of the prompts for Ayurveda de-prescribing. Typically this from our experience of encountering patients. Where do we usually start stopping medications? So very common, where the Rogi Bala is Avara. This from an Agni Bala. Agni is Manda or Vishama, Deha Bala, very frail Avara, Sattva Bala, Avara, and Roga Bala is Pravara. Where Roga Bala is Pravara, we need normally the imagination or the understanding is that prescription has to be strong. Prescription has to be taking care of all the components, but whether the Rogi or the host is really able to do it. So at this point, I would say that certainly if the Roga Bala is Pravara, prescription should be strong. We should not be worried or be fearful of not prescribing. Certainly, we should not compromise the treatment principles, but at the same time, it makes us to think that in such a kind of patient, the medications should be just right. They should be just adequate. Not just the medication, the entire approach of treatment, diet, lifestyle should be just adequate, that the patient is able to take it, patient is able to follow that, and we are able to see fast outcomes. And we have been doing this in our day-to-day practice, especially when we treat complex cases and vulnerable cases. So dose and duration of drug should be closely monitored, reviewed frequently with respect to both Ayurveda and allopathy vital parameters. Ayurveda parameters of Nidra, Agni, Mala, Mutra, Manas, and vitality, Ojas, and all allopathy parameters as applicable, BP, pulse, SpO2, RBS, liver function, kidney function, all of these things. In such a group of patients, tapering or intensifying should be actively done. We should not miss such patients when they are on longer prescriptions from us. Such a group of patient profile I have imagined, and whom we see daily are children, for example, pregnant women, frail and elderly patients, patients on various interventions like who are on frequent hemodialysis, patients with metastatic and aggressive cancer, CKD patients, patients with liver involvement, even advanced neurodegenerative conditions like PSP, ALS, where the phase has gone into behavioral changes, patients with intubation like nasogastric intubation, feeding jejunostomy, or tracheostomy, stoma, or with colonostomy, various kind of those patients, patients with history of various known and unknown allergies and anaphylaxis, and patients who are already on multi-drugs that I have been stressing upon, especially those who are on conventional life-saving essential drugs for multimorbidities. And there is also another scenario where Rogi Bala is Pravara, Rog Bala is Avara, and patients with minor ailments, minor symptoms, Swasthya, people are Ayurveda fans. This category of patients, I would call it as Ayurveda fans, who are into Swasthya Rakshanam habits of taking rasayanas, especially swaras, lehyams, etc., but have been continuing this for a longer period without knowing the harm that is happening silently. So examples of some of the Ayurveda medicines which are as legacy prescriptions. So we see like elderly patients, especially post-menopause, 60, 65-year-old women who come to us, who have been taking Yogaraj Guglu, Trayodasha Guglu for months and years together, in a way thinking that it is safe for bone health. It is indeed safe compared to NSAIDs, but even then, there is a risk of harm. All GI issues, diarrhea, vomiting, allergic rashes, and Guglu preparations greater than 3 months, certainly in male patients, affect their fertility and sexual health. So these some of the common examples. Similarly, ashwagandha. Ashwagandha has been a popular choice for immunity, wellness, vitality. Over a period of time, when taken at wrong time, in wrong season, and in wrong dose, with a wrong vehicle, gets into Agnimandyam, GI issues, weight gain if duration exceeds. And this we have seen in COVID as well. Lot of kapha increase, and this could be one of the contributors we have not analyzed for various complications like mucormycosis. Haritaki, a popular choice of elderly male for constipation, incomplete bowel, laxative dependence. We see a lot of people with Trifla or only Haritaki who come to us and who are also on other medications. So there is certainly a risk of harm, of blood clotting, increasing bleeding, and especially diabetics, it leads to hypoglycemia, as well as haritaki, although a rasayanam with all 5 tastes, Rutu Haritaki has been mentioned in classics, but people do not follow the exact prescription guidelines in which season, how to take with which vehicle. Therefore, Haritaki doing more of a lekhana action or scraping action in the body. So with this, I feel and I urge that de-prescribing should be for all. It should not be just limited to people on polypharmacy or polypathy, and it should be uniformly a thing, a concept for all Ayurveda physicians, for all the patients. I bring in patients as well, because we need to educate and inform the patients. Although Ayurveda is natural, Ayurveda is safe, but Ayurveda drugs have pharmacokinetics, pharmacodynamics with their components. They are so rich in their action that they are prone to cause certain adverse events in certain combinations. They can cause clinically unexpected scenarios. All Ayurveda students right from the beginning should be taught to stop medications, that CT all. We have been taught to do continue all, especially in our internship rounds, rotations. We need to get into this method, and our focus on PG dissertations also could take this as a subject, where instead of prescribing, what is the effect when this drug was taken off? How did the patient do when this was not prescribed? So this is something I feel very strongly that should be taken. All Ayurveda physicians should look into developing guidelines, should get together to think about this concept. Similarly, for all the esteemed policymakers, institution head, an algorithm which I have shared here is a beautiful algorithm which talks about how de-prescription can be looked into, and at various stages, and how you could just not reach on straight away discontinuing or stopping, but rather taking the path of tapering, kramen, what as was told, and kramen upgamanam, and then finally taking a call on replacing that with the right medicine. So everywhere where it talks about stopping, discontinuing, I add to that tapering as well as replacing it with the right thing. It could be a medicine, it could be a diet or a lifestyle advice that can take over, but at least what it will do is that it will prevent further harm. And where does with whom does all this lie? So primary responsibility, I completely believe that lies on the shoulders of a physician, and a physician where a characteristic that is required here is just pratipatiman, presence of mind, daily when we come across our patients, to make our chikitsa not only helpful or giving outcomes, but something which is extremely safe for them. With this, I end my presentation, and I'll stop sharing and look forward to hear to your questions.
Thank you, ma'am. That was a wonderful presentation. We did have a few questions which had come up right when the topic was shared itself. A few questions were from doctors, a few were from the general public and patients who follow us regularly. So we had listed it out, but then we did not want to interrupt you in between because the flow was very important there. So each point, each slide you were going through, I had noted down those questions. I had made tick marks on those questions which I could share with you. So shall I go forward with the questions which I have
Please
marked?
do, Dr. Girish. Hope there are the ones where I could do some justice to it, because this is completely a different topic and a topic that requires a lot of brainstorming.
Yes, ma'am. So the first question I thought, which was very relevant and very actively a doubt in most doctors, is shared by a doctor right when the information was passed that this was the topic. The first thing was, what if a patient comes to us with the question that I am already on diabetic medication in allopathy, but then I would want to shift completely to Ayurveda. It is not because of any problem with the medicine that I am taking, but I just need to come forward towards Ayurveda. So, what do you think is the right method to do in such a case?
Yes, so such situations we face every day, Dr. Girish. We see patients with people who are on OHS, oral hypoglycemic agents, or could be on OHA plus insulin. So we first need to determine what is the age and stage of the patient, what is the age and type stage of diabetes and prameha that the patient is on, and what are the other risk factors or other comorbidities that a patient is having. Having established that Rogbala and Rogibala, we need to understand what can we do from an Ayurveda perspective to take the patient through Ahar, Vihar, Aushad and Kriya. So abruptly stopping and switching over to a new system of medicine is certainly not the right way to do it, because from an allopathy or a conventional perspective as well, there is good amount of understanding of the disease. There are guidelines which are laid over a period of their clinical trials, of their clinical experience, and these guidelines get updated with respect to biomarkers. So keeping that in mind, it is certainly that we should not immediately take an action or ask the patient to switch over. Always it has to be monitored, observe, understand the trend of sugar that the patient has. Or you may even see that patient is on OHA plus insulin, but suboptimally managed with HbA1c around 8, 9, and the drug is not completely working. So at that point of time, we can take charge or we can take hold of that situation to see how do we bring in a scenario where we start seeing a drop in sugar. When we see that, we need to see at what point, at what type of an Ayurveda intervention that the patient is responding. Based on that, we can guide the patient. If it is ideal way that I would wish to do is that to have a review with his treating endocrinologist or a physician and advice. Take because we now see that the scenario is changing. Doctors are a lot more open because even they know the side effects and that if something naturally can be managed, patient should be guided to do that. So my advice would be to never abruptly cut off and allow the patient to shift. Even if the patient wants to shift, one word of caution as a physician should go from our side that how we could help to do that steadily and over a period of time.
Yes, ma'am. Thank you. So when this topic was being mentioned, there was another question which came from a patient's side, which I thought again was very relevant. Now the question goes somewhat like this. Now that we see a race among doctors saying that diabetes is completely reversible and you can come out of medicines, is it really possible, and if so, coming out of medicines is really advisable or not, and how to go by it?
Yes, so going to this concept of reversibility of diabetes, so this is a concept which has been laid down in our samhitas. If you look into Shushrut Samhita, there is a word which talks about prameha nivritti. That prameha nivritti, which means that from that particular samprapti of prameha diabetes, patient is out. No more the internal environment which is making him towards being a diabetic. Once that prameha nivritti is attained, Ayurveda, another reference in Charak Samhita Chikitsa Sthan, which says that vata pramehi, which is asadhya, can go back to the krach sadhya or yapya state of pitta. So it's a reverse mechanism. From vata, that stage of samprapti can go to pitta, pitta to kapha. By that, it does not mean that the doshas are changing. By that, it means that something which is incurable in a vata state, by doing the right things, by following the steps of samprapti reversal, we are able to get the patient into a state from vata to pitta to back. So that's a beautiful shloka which talks about prameha nivrutti from urine markers that have been told. That once that is attained, reversibility is possible. But practically, as we can see that we see patients of pre-diabetes, we have been seeing this almost now more than 10 years and more, that patients of pre-diabetes on around 5.7 to 6.5, easily when you guide them to go through a proper thing of ahar, vihar, aushad and panchkarma treatment as per the state, we see a good reversal in about 24 days. And this 24 days duration coincides with the cycle of HbA1c, the glycated component of hemoglobin that is there. With this, the next stage of mature diabetes, from moving from getting or arresting the complications. And again, people who are in complicated stage of complications, both micro and macrovascular, we see a lot of them with microvascular, as you also would be seeing retinopathy, nephropathy, neuropathy, gross macrovascular complications, IHD, CAD, can be, the process can be reversed. Although this we see from clinical perspective, we need to prove it on biomarkers and molecular markers. So people who say that is diabetes reversal, I say that the disease process of diabetes is reversible. We need to follow the steps to get into the reversal of complaints, the presentation, and also that reflecting into blood biomarkers, FBS, PPBS, also HbA1c, urine, presence of glucose in urine, and the ultimate test of microalbumin.
Thank you, ma'am. So this actually is connected to the next question I had. This was from a doctor again. This time the question was, about 15 to 20 years back, normal blood sugar levels or pre-diabetic levels were considered to be somewhere around 6.5 to 7. Now it has reduced. Does that mean this is a necessity for increase in medication during the very early stages, or is this report flawed?
Yes. So a recent publication which says about 7 to 8 in US population, which is considered to be okay, like it doesn't call for straight for insulin, but the ACE guidelines still do not endorse this. So this observation or similarly is a reading for BP, that now the reading is being taken as 130 by 80 or 140 by 90. But more than that, I would not just go by the readings or markers that have been laid down, or that should not be the only gold standard or criteria to intensify or taper medications. Completely from an Ayurveda perspective, even if the patient is at 6.5 with other things which are so fast, which are driving the samprapti, I would look from an Ayurveda perspective for the other contributing factors and not just the gold standards.
Thank you, ma'am. So I think that is an answer most of us were looking forward to listen to, because that is a question which comes to every practitioner's mind when they look at the reports. So there are questions which have come up in the chat box as well, ma'am. So Triphala is most used formulation in Ayurveda. Will you please share caution and side effects of prolonged use of this formulation? This is a question by Dr. Sudhir.
Triphala is a very good Nitya Rasayana, consists of Haritaki, Bibhitaki and Amala, and in various aspects or there are various indications of Trifla, right from Jara Rasayanam to Chakshu Rasayanam to a thing which helps for good bowel, etc. So caution for Trifla that I would look into is looking into all three. I would dissect it into three ingredients, Haritaki, Amlaki, and Vipitaki, and based on that, my advice would be again to follow for a certain period of time. That certain period again depends on whom am I prescribing to. Is it for wellness? Is it for eye? For what condition that I am prescribing into? I would decide the matra and kal according to that. And word of caution would be that anything which goes beyond a period or beyond or for a prolonged period, there is a risk of getting it satmya. So we should taper it, and word of caution would be that in a higher dose in a prolonged period, that it would do a scraping action. It would do rukshana. So we should be careful about how it is used, right vehicle, time of the day, season, all that is important.
Thank you, ma'am. So there was another question from another doctor regarding Rasaushadis. The question is, how long should a proper prescription of Rasaushadi continue? And if we stop, if the symptoms are coming back, do we need to restart the Rasaushadis, and when should we actually do it?
Yes. So while this thing of Rasaushadis, even today that when I was looking for Samhita search and doing a review on various medications, a common thing like Brahma Rasayanam is a Rasaushadi. It does contain Bhasma. It does contain like even Swarna preparations that Charak Samhita mentions, various around 86 asavarishtas, lot of these things which somewhere or the other contains rasa preparation. Now, from that perspective, rasa, it is not that because it is a rasa aushadhi, it should be taken for certain duration. Again, how is the preparation? What is the preparation for? What are the ingredients? What is its mode of action? That should be considered. Mostly, rasa aushadhis are prescribed in acute conditions like pain, bleeding, or any kind of febrile conditions, breathlessness. So we need to see what is it that we are prescribing a rasa aushadhi and what is its mode of action, which is the target organ, or which is this organ, for example, of liver, kidney, and intestine, brain. Of all these organ, where is it that this drug can cause more harm, or where is it getting metabolized? Once we know that, we can prescribe for that certain limited period of time till we achieve the response. And in that certain period of time, if it does not give response, certainly I would not ask to restart, because which means that either my drug is wrong or I have not understood the samprapti for which it is not working. So I would reconsider the diagnosis. Rather than restarting the same medication.
Yes, ma'am. So when I was listening, okay, I think there is a hand up by Mr. Rajiv Vasudevan, sir. Sir, please.
Thank you very much for a good presentation. Just a couple of queries. From a very different angle, when patients de-prescribe, right? Now, in modern medicine, you have antibiotics you got to take for a minimum number of days. Imagine from an Ayurveda perspective, you're given it for 2 weeks or 3 weeks, right? And is there any situation where a patient stops consumption, and therefore, is there in any situation in Ayurveda where by stopping and before the full impact of the medicine is there, is there any other impact? It's just a theoretical question, number one. Number two, if you take in the context of de-prescribing situation, I was wanting to understand is where you have, let's say, cancer palliative care, and you have chemotherapy drugs being administered to the patient. Along with that, we are wanting to co-administer Ayurveda, right? So how do you decide when to stop, how to stop? Is there an algorithm that can be done? And third question is, you kept on clarifying there is no gold standard to stop this or that, etc., and various considerations, but can there be an outer limit be given? Assume I'm taking kashayas as are manufactured in industrial setting today, right, with preservatives and other things being added to it. Would you just put an outer limit and say no patient should take more than one 48-day or 41-day period? Right? So this type of thing, is there a need to bring in outer limit telling you must consult your doctor before you go? Because one of the issues we see today, people have been taking for 2 years, 3 years, whether there's impact or not. So these are 3 questions. I hope it is clear.
Yes.
Thank you very much.
Yes. Thank you, sir. The first question about patient de-prescribing Ayurveda medications. Yes, we do see that. And there are various reasons for this. First reason, which we find uniformly, is palatability. Patient does not like the taste of the medicine and is not able to comply or adhere to the guidelines or things that are being told. First thing that they would abruptly stop. So in such a situation, it certainly affects, it has an impact, because prescription, an ideal prescription, as I was sharing, it includes various components of Chikitsa Siddhanta, a drug to carry out an Amapachanam, a drug to carry out Vatanulomanam, and even if it is a Mrudu Shodhana or Vatahara or a Virechana effect that we want to have it through the medicine. But if one of these components or one of the medicine of that entire prescription, if a patient abruptly stops without informing or without discussing with the doctor, the impact, first major impact, is on the Chikitsa Siddhant itself. We are not able to achieve that enough grip on the outcome. So first thing I feel is that the impact is on a compromise on Chikitsa. So that is something.
Okay, but the connected point, in a connected point, I just wanted to ask, therefore, is it not incumbent on the doctor and the system to come up with those very specific educational guidelines when medicines are prescribed? Right? Yes. To tell that you should not stop in between, you should not do this, do that. But we rarely I see that being educated to the patients.
Yes. And yes, and that is right.
Yeah.
That is right, sir. Actually, we need to explain and we need to make the patient really educated and informed about what the drug is going and doing. If that importance is ingrained in his brain, he really would comply and rather would give us good feedback that by taking this, this happened, I could see that, I could see these changes. So that is a need that we need to continuously do with the patients. Yeah. And the second question on cancer palliative cases, where we deal with the patients where ongoing chemo, ongoing therapies, how do we decide on what to prescribe? So while working with the oncologist, surgical oncologist, medical oncologist, and various, because there are various scenarios for a cancer palliative care patients, that they are also already with the palliative care team, and a lot of the things are only like temporary symptom management and not really focusing on the cure of cancer. So at that point of time, when an Ayurveda prescription is being requested and a patient wants to do that, we have to discuss actively with the patient as well as with the treating doctor to avoid that overlapping mode of action, because that is the first harm that happens to the patient who is on.
No, the question is there any norm or an algorithm? Is there a formal rule that you would apply? Was the question.
So first rule would be to ensure that there is no overlapping mode of action. One. Second, to discuss the goals actively with there is no formal, currently even in integrative oncology space, there is no formal algorithm available on how to prescribe and how to do it. Referral comes, we take it up, we discuss the goals of treatment. But we do feel that there is a scope to develop such a
Thank you, Doctor.
protocol. And could you repeat the third question?
The third question was an outer limit
Yes,
on this thing. Yeah.
Yes, outer limit is indeed very important. It just cannot be that it is based on yukti. We need to come up with the outer limit for kashayas, churnas, especially asavarishtas, which are really which is causing greater harm to the GI system. Lahyams also, for example, which are being taken endlessly. I do feel that upper limit of medications of all Panchvid Kashay Kalpanas should be brought in.
Should be what, please? Could you set a number?
So it should be, again, in days, it cannot be months or months together. For example, Kashaya. So if we have to achieve through Kashaya Amapachanam, it is almost that such kashayams like Amritottar Kashayam, which has Shunti, Pachanamrut, or other Goduchyadi, we need to achieve in less than 7 days for that particular action. And those kashayas which are brumhana in nature, where we want the physiology to get into rasa raktamams up to majja or shukra dhatu, it could be 14 to 28 days. So what is missing right now is mapping of physiology and pharmacology. So if we can do that, we will easily get the answers. For example, Brahmi Drakshadi, role of that, if we want to achieve to go up to Majja Dhatu, we need to have it, we need to see its impact in another 14 to 30 days.
Thank you, Doctor. Really appreciate it.
So, Doctor, there was a comment as well. I mean, there is a loud thinking, I think. Why are we not including this in our curriculum? Is it not essential that it start from the classes?
Yes, I did bring the point on students getting involved as a part of this concept which is there. And this is important that, and especially if de-prescribing or taking off drug and what is its action. If this is studied in comparative groups and in PG research, PhD research that happens, I think it will add lot of value. Because when I was doing this research, this review on the conventional side, all the guidelines, if you can see, like STOP and SMART guidelines, BARE guidelines, some of the things on de-prescription, there is a MedStopper tool. All of these kind of tools on de-prescription has been derived after such studies and clinical research of taking off the medication and replacing it with the right thing. So this should be a part of curriculum.
Yes, ma'am. So the next question is, it will be, okay, next point is, it will be great if in Ayurvedic medicine potency, that is Virya, is mentioned whether hot or cold. I am not a doctor, but find this missing in formulations.
Could you repeat that? I missed that. I missed understanding.
Yes, the person is suggesting that the Virya, whether it is Shita or Ushna, should be mentioned on formulations.
Yes. So like that, there are a lot of, not only everything, Ras, Gun, Virya, Vipak, Prabhav, everything should be known. And the point is right. The labeling guidelines should include duration, should include, like this is again a topic that we need to brainstorm and come to a guideline that, because right now the labeling guidelines, many of them do not include ingredients. It does include a reference, but ingredients are missing. If it is a drug like Bruhat, Trifla, or something which has, or Maharasnadi, etc., it does not include all the ingredients. Part of it are mentioned, some of that are not mentioned, excipients, preservatives, everything. So again, this is something which needs to be taken up.
Would Mr. K.S.Varier want to add something on this, on the labeling part?
No, I don't think I need to express this, because see, we ensure that the label contains all the ingredients. First thing. Another thing is, if it is for the classical preparations are basically for prescription. They are not over-the-counter drugs. So the doctor knows the potency of the classical preparation. For example, the kashaya, where the doctor knows how the kashayam is made. What is the concentration that the kashayam is made out of? So it is for the doctor to understand, and the doctor definitely knows when he or she is prescribing. So I think the patient need not worry much about that aspect of the virya part of the drug, because the doctor takes care of that.
Thank you, sir. I also would like to add something here, ma'am. So I think according to the question, if we do mention the virya on the label and all that, the problem with Ayurveda is if I see that this particular ingredient is Ushna virya, I should not feel that, okay, I have a feeling of heat in my body, so I should not be taking this. So that happens with patients most of the time. They think that, okay, this is hot, so if I take it, it's going to affect me.
So more than putting it directly in that way, right? We should make it in a way that which is understood by the patient, yet which correlates with the classical characteristic of the drug. I don't mean that we need to just put it that way, but we need to really translate it and come up in a way that it identifies which category of drug that is. If that is told in advance in a way, if we need to rethink about labeling, it would make the compliance a lot more better for the patients.
Yes, ma'am. The next message here, an important topic presented in a simple and elegant way that is understandable to a layperson like me also. Really enjoyed it. Logging off now for a procedure. Thank you, Sujata. There was another point. Considering herb-induced liver injuries, when we consider taking Nitya Rasayanas such as Triphala or any other Kashayas for longer duration in chronic conditions, how do we consider de-prescribing, considering preservatives are higher in available medicines, especially to maintain longer shelf life? For example, shelf life of Churna is 1 month classically, but available Churnas are for 1 year.
So I would read the question once again. Considering herb-induced liver injury, when we consider taking Nitya Rasayanas for longer duration, how do we consider de-prescribing? So I almost answered that part of the question that it is Matra, Kal and Yukti, that even if it is a Nitya Rasayana like Triphala, we need to understand for what purpose. Nitya Rasayana is too broad to say. It is not just that the person who is taking is completely healthy, right? He or she may have a lot of things for which the Rasayana is being taken. So identifying those risk factors and identifying who is prone to. We know that if this drug is not taken in a right way with this kind of a preservative, patient may have liver injury. If not liver, any other organ injury may happen. So de-prescription or that guideline of prioritizing and stopping should certainly be completely patient-centered, that why it should be stopped and at what dose. May not be that de-prescribing really means that you take off. It also means tapering. It also means changing the vehicle. That whole aspect of changing the prescription, I think we should take it that way and then apply and see the outcomes.
Yes, ma'am. Thank you, ma'am. I would like to remind all participants that the link for the giving the feedback will be available soon. My colleague Vignesh, he has already put forth the link for the feedbacks. Kindly please look into the link and fill out the small form that we have in the feedback form. It helps us maintain the programs in our webinar series. In advance, thank you for everybody to putting the feedbacks. One other question I had with one of my doctor friends who had asked about medicines. So is it really possible to go for medicines which are equivalently as the activity is same in allopathy and Ayurveda for lifestyle disorders like hypertension? So I think this person is mentioning about a recent experience he had undergone when he had had to change because the patient was specifically wanting to change the medicine from allopathy to Ayurveda, and he had prescribed and he was successful in getting the patient out of medication. So what he's trying to ask here, I think, is that the action, mode of action in both these systems are going to be totally different sometimes. So how do we consider that, because we are not studying those kind of activities which are happening in allopathy, and what we learn in Ayurveda is slightly different.
So we have learned this concept in our first year B.A.M.S of different types of Ayurveda being practiced. Is it like allopathy style Ayurveda that we go for a replacement? Because the patient doesn't want an antihypertensive, we prescribe Cardocam or we prescribe Punarnavadi, Mandur or whatever, like with similar kind of diuretic action. In my view, this is risky and this is not classical Ayurveda. When we have to understand from completely a classical Ayurveda perspective, we may be able to get the outcome that you replace Telma with Cardocam, you may see a drop in BP, but will you see this uniformly in your patients? My answer is that no, we don't see that, because various etiological factors that are contributing. So if one has to look into a shift from conventional medicine to Ayurveda, one should stick to science. One should stick to classical Ayurveda understanding of Nidanas up to all factors, Samprapti, Vighatan, Nidan, Arthkar, everything that is contributing. From that will emerge that what you need to do to bring the patient back to normalcy or a normal state.
Thank you, ma'am. So there is another comment, impressive presentation, that is from Dr. Sudhir. I would want to ask our medical superintendent, Dr. K.S.Varier, to give a few words on this presentation, and if he would like to interact with Dr. Zankhana.
Hello.
Yes, sir.
Hello.
Namaste.
Namaste. Namaste. Very happy to have this interaction between us. At the same time, what I suggested, because everybody coming out of the college, they are eager to have patients. They don't want to miss them.
Yes.
At the same time, they will be in a dilemma whether to prescribe this or that. So naturally, too many medicines they will be gradually prescribing. In due course only they can identify that is years together. After prescribing only, they oh, this is not needed, this is not needed. So in the same way, even I have been going on this years. So what I have past around, so even though I am practicing for the past 50 years, past 30 years I have changed my line. Minimize the medicines. One thing we can do that. The same time, what I suggest that is in Pathya there is a line. In the same way we can do in this medical, that is giving prescriptions also. So gradually we can do that, but at the same time, very that is Yapiam or Prasasadim, it is very difficult to stop the medicines.
Yes.
We can change the type of medicines, not giving the same type of kashayas or rasa preparations, or which may be harmful.
Yes.
Not everybody. Some that is actually Rajiv was telling that the patient is wanting the same medicines, even without our knowledge, they are getting it from the clinic. That's another problem. We cannot. We are not knowing about that sales. So for 2 or 3 months, or even after 1 year, they may be telling us, "Oh, this I have been continuing saying I am happy with that." So we cannot deny that also. In such a situation, we are in dilemma actually whether to continue it or not. So gradually, actually, main thing is we have to reduce the medicines. Gradually, we can stop if needed, or if it is possible. At the same time, they should maintain the lifestyle. That's the main thing. That's why what I have been doing all these years, the same thing. So other doctors can also may
Yes.
follow. Okay. Hey, thank you.
Thank you, sir. So
Okay.
I would like to ask any of the guests here, if you have any more questions, you can put it in the chat box, or if you want to ask directly to Dr. Zankhana, I think she would be able to, she would be welcome to get your questions as well. Would anybody want to ask any more questions? So I think we come to the end of the question answer session, ma'am. It was a very interesting session. One thing. Second thing was it was very informative as well as an eye opener. So to most Ayurvedic doctors who are listening to this and who are looking at this, I think the perspective of prescription must have changed by now. And that is a welcome change which we need to look at. I personally myself have also been looking at on a smaller scale of the thought, me stopping medicines for the patient or reducing medicines for the patient has been helpful for me on a popularity scale among the patients that way. So at least on the smaller thought of popularity, I have found out that that works very well. And if I concentrate more on the dietetics, because I had also done a course in nutrition, it works excellently well when I'm actually able to give them point-to-point advice on the dietetics and nutrition part of their food, which they already eat and things, because people already have an idea that they think that pathya is something which they're not going to enjoy. Whereas if we can put forth ideas that pathya is also enjoyable, pathya is also tasty, there are books like Bhojana Kutuhalam and all that, through which we can bring out very interesting and beautiful recipes, tasty recipes. That those advices, if we can include with our prescription, this might also help them get out of their medicines. So I think there is one more comment which has come up, one or two. So yeah, very informative session and very good presentation for a layman like me who keeps a keen interest in Ayurveda. I got the outlook on the topic. Thank you very much. One, Mr. Raghavan Ji. And there is another, can we set certain guidelines of criteria for Satmya by Dr. Rekha?
Yes. So this thing of Satmya, and we can certainly do that as physicians, because we have been seeing patients, especially like diabetes, autoimmune conditions, who need medicines for continuous time, and we need to take them through. Normally the cycle goes that a prescription followed by Shodhana, followed by maintenance of a prescription, one more round of Shodhana, and the prescription continues. For this kind of patients, certainly we should start observing and start noting it down in terms of at what point does the medicine stop working, or but again, we cannot just attribute to the medicine not working. There could be multiple factors for which the outcome is not so great, but we need to write down, like patients developing resistance to antibiotics like AMR. We need to bring this concept of resistance to Ayurveda medications, and at what point, especially some of these chronic conditions where patients are on prolonged medications, we could start observing and start noting that, and then move towards setting up guidelines.
Thank you, ma'am, for that answer. Any more questions, anybody?
Since you mentioned about autoimmune disorders now, so I have a small question. Can I go for Dr. Girish?
Please, sir.
Yeah, thank you very much. Like, my brother is suffering from lupus nephritis class 2. So he's been on this steroids and other stuffs for the past 5 to 6 years. So now that he was also taking Ayurvedic medicines for some time, but then we stopped that over a point of time. Now, is it like, can he take both the medicines together or something like that?
So as we have answered that in some parts, that he needs to go through a proper consultation to ascertain the points of the current status that he is having with respect to lupus, as well as looking into lupus nephritis. So with that, we would be able to help your brother in terms of where is he and what is the current requirement, while his steroids and other things from a conventional side are going on. From Ayurveda perspective, at right time, it can be integrated with a right prescription, which is safe for him, which brings down the inflammation, taking care of nephritis.
Thank you very much.
Thank you for the question and answer. Any more questions, anybody? I think we come to the end of the question answer session with that question, ma'am. I would like to ask our Executive Director, Mr. K.S.Varier, to give a few words.
And it was such a pleasure seeing you presenting that topic. And that topic is very critical in today's world, particularly in today's world when we are raising to take drugs. Lots of drugs, everyone I hear are taking some drug or the other. I think it is time that we went back to nature, stopping all medicines, and get back to a state where the body heals itself. I think this is what you have driven, the point that you actually have to facilitate the body to heal by itself. So by reducing prescriptions, by de-prescribing and setting the body to its own standards, and this is what we are looking for, and this is what is the ultimate aim of, this should be probably the ultimate aim of every system that we have today. So I think for that information that you have given, thank you very much. And it was a very deeply thought out, your passion was seen in the presentation, and we could all get what we actually, a lot of information. So I think thank you very much for this. And definitely I've taken some notes. So I'm sure our people would have taken notes, and they would definitely pass on this information to their friends also. I only wish that this goes into the curriculum, because the curriculum needs this. People coming out of colleges are, little educated about all these things, and they don't know really. Poor children, they don't know. They have to be educated in this line, even prescribing the proper drugs. I think with that, I think I'm deeply thankful to you for this presentation. Thank you very much. Thank you, Mr. Rajiv, also being here on such a day, taking your time off and coming here. Thank you very much.
Thank you. It was a pleasure. Thank you for this opportunity to share this perspective. Thank you.
Ma'am, there is another comment from Dr. Rekha. Many thanks to Dr. Zankhana and Ashtanga for a wonderful and thought-provoking session. Rajiv sir has also added echo Dr. Rekha's comments. So
thank you, Dr. Rekha. Thank you, sir.
Thank you, Dr. Rekha. I have had the wonderful experience of working with Dr. Rekha as well in my past experience. Past few years, I could work with her. So with that, I'd like to come to an end of this session. Thank you very much, ma'am, for taking your time and being with us and giving us a great session, an eye-opener. And I know that most of us have taken a lot of take-home points from your session. And thank you, Rajiv sir, for being here as well. So with that, I come to the end of this session. Thank you, everybody, for a wonderful evening. Let us all meet again with another session in a month's time. Thank you, ma'am.